And as you know, the longest government shutdown happened in President Trump's first term. That was 35 days. But at some
Right.
point, the government can't shut down forever. It's not shut down yet. It's looking that way. But someone's going to have to buckle here. It doesn't seem like anyone is right now. What do you think is going to be the breaking point? I mean, how long can this go on?
House Democrats had a press conference on the steps of the United States Capitol this morning, and we had people who would really be personally impacted by the increase in healthcare costs if Republicans refuse to extend them. One woman who has twin 13-year-old boys, both of whom have autism, if she doesn't get those enhanced premium tax credits and Medicaid isn't restored, her boys are going to be devastated. In terms of their health and their progress. Another man joined us who has stage 4 rare cancer. If he doesn't have those enhanced tax credits, he won't have healthcare coverage and won't be able to get the kind of cancer treatment that he's been able to stay alive as a result of. These stories happen all over the country right now, and even more of them will occur, millions more, if Republicans don't just. We're supposed to negotiate. The founding fathers created a legislative process that requires us to sit down and reach across the aisle. No one gets their way completely. I've always worked in a bipartisan fashion, as you pointed out. We can sit down and negotiate this, and give a little, take a little, and avoid a shutdown. Even if we shut down, we should be sitting down immediately, not waiting 7 weeks. People who need to make sure they have affordable health care, they can't wait 7 weeks because those premium increases are coming starting tomorrow.
And as you know, service members don't collect a paycheck when the government shuts down. Federal workers don't collect a paycheck when the government shuts down. Congress does still get paid during a government shutdown. Republican and Democratic lawmakers did say that they would defer their paychecks. Some of them have, should the shutdown come to fruition. Is that something you agree with?
I think every individual member has to make their own choice about whether or not they can afford to forego their own pay. I mean, from my perspective, I want to do everything I can to avoid a shutdown. And that's what I'm going to do, stay here, make sure that I can focus on trying to get everyone to the table to ensure that we can cancel the cuts and keep people's healthcare costs low and save people's healthcare. That's what this is about.